All right, welcome everyone to our first Food for Thought Equitable Health Solutions during COVID. This is our first of a series of happy hours with heart. So today we're going to kick it off with Claire Neal, CEO of Lifelong. I'll let you take it over, Claire.
All right. Well, thank you so much, Allie, and thank you all for joining us today. It's always a pleasure to be with people who are passionate about health equity and have really helped us as an organization to remove barriers and ensure our community can live their healthiest lives. So thank you for being with us today. We're really excited to have you here. And I'd also like to thank our sponsor, Tito's Vodka, for providing us with some of the tasty cocktails. For those of you who registered early and got one, I hope you're able to enjoy that now. So thank you again to Tito's. Before we get too far in, I just wanted to take a quick moment for a few housekeeping items. This roundtable is being recorded and it'll be shared with you later this week. So I wanted you to know that. I also wanted to remind you that we will be answering questions at the end. So please do use the chat feature to ask questions, and we'll try to get to as many of those as we can at the end of the session. But for now, I'd like to welcome our featured speaker for today, Dr. Myint. Dr. Myint has been really just a guiding force for us on our board of directors, especially throughout the COVID epidemic. He's an infectious disease specialist and epidemiologist. He has extensive expertise in leading efforts around clinical quality and patient safety, risk management, and the population health model. And we've just all benefited greatly from his insight and advice. And I always really enjoy our conversations together. So I'm excited for you all to have the chance to talk more with him as well tonight. So welcome, Mike.
Well, thank you so much, Claire.
Yeah.
Thanks for having me, and I'm really excited to have this conversation also. And it sounds like the cocktails are fabulous, according to the chat box.
Good. Well, so this is a good time for us to have this chat because this month marks 1 year for me in my role as CEO. So I think others may not, that I started just days before COVID hit and everything shut down. So that has given me a little bit of an interesting perspective on just learning the organization of Lifelong and the community at large. And I think for me, one of the things that I was just really so blown away by when I first got here was how our team at Lifelong just picked up the challenge of responding to the COVID crisis. Just immediately started reaching out to the community to try to understand what the needs were, adapting our services, and then figuring out how do we reach those who have these great barriers to care already, and now those barriers are even greater. And so, as I looked at this, it was really inspiring to see how the team just hit the ground running. It was almost as if they had done it all before. And of course they had, because I think many people here know that Lifelong was formed during another deadly pandemic, the AIDS crisis. And so really Lifelong is the result of people coming together during the AIDS crisis and saying that they're not going to let their friends and neighbors suffer alone. They organized soup drives and advocacy days, and really just formed together to create Lifelong and a response to how we come together as a community and face a pandemic like that. So that was obviously way before my time, but I know, Mike, you've been involved with the organization for almost 2 decades. So I'm wondering if you can tell a little bit about your time and what brought you to Lifelong.
Yeah, well, Claire, thanks so much for just for framing this conversation, because I do think that sometimes we forget that it was 1981 that the first cases of what became known as AIDS, but was called a lot of different things, GRID and a couple other things before. It was 1981, and if we can recall back, this was before my clinical practicing days, but during my collegiate days, we didn't know a lot about the disease, and there was a lot of fear in the community, which we've experienced here with COVID. There was also a lot of stigmatization among the groups that were early identified as having HIV/AIDS, and that's not just the LGBTQ community, mainly the gay community, but also, in regards to patients who are hemophiliac or, Haitians. I mean, there was a lot of different groups, IV drug abuse, and it was easy to stigmatize sometimes a lot of those groups. And we're seeing that also today. We really talk about the two real great pandemics of my career, and really it's AIDS, which really defined my profession and my professional choice to become an infectious disease epidemiologist, and then COVID. And as I look at the time, my involvement with Lifelong really started when I entered clinical practice. And my patients who suffered from HIV, and I treated them, especially in the earlier days when there weren't really highly effective treatments. My patients had a lot of needs. The drugs had side effects. Sometimes my patients had a lot of social determinants, issues that prevented them from really reaching their full health and wellness. And Lifelong was a lifeline, really, for myself, my patients, obviously, and many of the providers that took care of patients who were HIV positive in the community. And really that's where my engagement with Lifelong began, is as a referral and as a partner in care for our patients that we did. So, I think that, as we kind of look forward now, I think that, I'm really honored to have served on the board of Lifelong once my clinical practice, and I'm doing more administrative work these days. But then I was offered the opportunity to give back to Lifelong by joining the board, and it's been a real honor for me. And Claire, you've been just such a fantastic addition to the team, and your leadership coming in during the second of the two great pandemics of my career. So, just much appreciation to you for your leadership during this challenging time, and of course to all the members of Lifelong and our communities and partners to have leaned in so much.
Well, thank you. I mean, it's been incredible to work with you, and I know we've leaned on you a lot over the last year, and your expertise. So, you mentioned some of the trends that you were seeing in HIV at the time. I wonder if you can talk about that a little bit, because I think we do see some similarities in what's happening with COVID now.
Yeah, the health disparities obviously aren't something that the pandemics create, but what pandemics do, or what health challenges do, be them a natural disaster like Katrina, or an AIDS pandemic or a COVID pandemic, is really unroof what underlies some of the challenges in the United States healthcare delivery system. And that disparity, and we're going to take a look at a slide here. This is actually a recent slide, but this really tells the story of the whole arc of this. This is a 2018 study that just basically shows the comparison of new HIV diagnosis compared with the percent of the US population. And you could see that, the Hispanic, Latino, and Black race and ethnicities are vastly disproportionately still affected by HIV new diagnoses and the disease burden. And, these health disparities by both socioeconomic and racial groups still persist to this day and existed throughout the crises. And again, it's been an area where, for those kind of suffering disproportionately, organizations like Lifelong, regardless of payer, regardless of ability to, of having insurance or not, Lifelong was able to really wrap those services around our patients, my patients and the community's patients, that allowed them to really do well enough to get to the now very effective medication therapies and help patients afford these type of therapies through connecting them with grant programs, getting them insurance. So these trends, are pre-existing, and COVID again sort of highlighted a lot of these health inequities caused by challenges in social determinants of health.
Yeah, I'm so glad you mentioned that, because I think that's one of the things that we've been struggling with, or these are the issues that have been disparities all along. We continue to see them in all kinds of different realms, but when you had COVID come along, I think it kind of shined a bright light so that everybody could see that these disparities were happening and could see where our systems were falling short. I mean, and at Lifelong, our mission is to remove barriers so that nobody is facing that dual burden of illness and injustice alone. So a lot of what we talk about are what are those structural barriers and how do we work to change change them. And I wonder if you can speak a little bit to what you're seeing as those barriers with regard to COVID and what the root causes of some of those might be.
Yeah, I think that the next graphic that we were going to review is a little bit of kind of how I frame, and especially in my role in population health, at a large healthcare organization here in the state. I'm a physician executive at MultiCare. And when we talk about health disparities, really we talk about these social determinants of health. It's sort of the current terminology, but we've always referred to health disparities and the inequities in the way we do health delivery. The interesting thing to me, and sort of inform my journey as a clinician, and then as a hopefully trying to do some transformative changes in the way we deliver care, is that healthcare organizations, even though key and critical for the community when patients get really sick, for COVID, our intensive care units were full and our hospital beds are full. But when you aggregate what really helps patients with their health outcomes, that is length and quality of life, right? That's the health outcomes that patients really care about, because that allows them to spend time with their families and do things that they love, and earn a meaningful wage and help their kids and do those things. Clinical care really only accounts for about 20% of what drives that. And it was sobering to me after going through medical school and doing this. We know we do a lot of really good work, but once I started really understanding this model around social determinants, it really does show the importance of lifelong, because if clinical care does 20%, but patients have challenges across 100% sometimes of barriers that are in their way that aren't necessarily of their own doing. Some of it is their health behaviors, and again, that can be informed by the environment and a lot of other social economic issues. But the physical environment, healthy behaviors, and that's where lifelong comes in. Food insecurity, housing insecurity, access to social services, medication payments, insurance. These are the things that keep people healthy. So I really feel like that model where lifelong really helps with that 80%, that really healthcare organizations like mine, and especially it gets to that last mile, right? It gets down to delivering that meal during COVID for a patient who can and should stay at home, especially during when we were in the stay-at-home orders. Lifelong really did activate all of its services to reach out to the communities and meet them where they needed to be met, and I'm really, proud to be part of an organization that really organizes around addressing these social determinants.
Yeah, thank you for sharing that, Mike. I always find this so interesting, because I think as a society, we pour so much effort into that 20%. And really, there's so much room in the other 80% to be able to influence health, to be able to help people get on a good path. And there's just so much opportunity around that. And I don't know if you can put up the lifelong model slide, Allie, but for me, one of the things that drew me to lifelong was specifically this model of whole person care. I think this is just so important to how we interact. For lifelong, we really look at the person at the center. And then think about all the different needs that a person has. And, for some people that may be housing and food and nutrition and access to care. For other people, it may be social support and employment support and care and prevention. So those services that we offer can flex and change depending on what the person's need is. The other thing I'll say that I think has really become apparent during COVID is that this is not a static model, right? That these circumstances change and change often and can have a big impact. So somebody that's in stable housing today, they lose their job, there's an outside influence, and that can affect their access to all of these different determinants. So it's something that changes for each person and then changes for people over time. And just personally, I know that's part of what attracted me to public health, is the idea of creating systems that are really supportive to a person's need and that understand the complexity of what people need to be healthy and how you fit that all together. And I think, again, from Lifelong's perspective, that's what what really drew me in is that Lifelong has had, almost 40 years of honing this model and really figuring out how do you provide this holistic and ever-changing support that starts with the person first. And it's been really fantastic to learn more about this model and to become a part of this organization. So I'm a big fan of the model and really seeing how much that has worked and how much this has been able to impact our community's lives over the last year, particularly during the COVID epidemic.
Yeah, Claire, as you show this model, I think that, one of the really kind of key things, COVID, has had multiple waves, right? And those waves have triggered a lot of different, both, epidemiologic or the medical and then the epidemiology of it, just the disease parts of things. And it has affected a lot of different communities in a lot of different ways. But as I look at this model, it's also caused a significant amount of economic trauma, especially for many groups that the social distancing and a lot of the shutdowns of gyms and of restaurants and a lot of other things. It's affected people in many different ways. It also, as I just kind of go around the sort of circle around the patients and communities that we do, the care and prevention is also something significant. Patients who've had to stay at home have increased depression, increased anxiety. And we heard at actually one of the Lifelong events last year on some of the really positive things that the folks who are helping deliver food, they are not only delivering a key and necessary, part of the patient's, wellness in healthy food being delivered to their house, but also just a bit of social interaction, right, with someone, even if it's just, hey, here it is. That sometimes for some patients who have a lot of social isolation to start with, and then are have chronic diseases that needed to stay in place, and then when you wrap around dental care, employment, and the key social support that my patients, I felt that those were the key things that Lifelong really added to my patients, was really around that social support. They were able to engage in a community of care that really understood them. And in fact, many of my patients ended up coming back around and either volunteering and or working for Lifelong, because Lifelong really helped folks get back on their feet. And if they were able to do well, which many or most of our patients do now with the really effective medications for HIV, and now Lifelong has really taken on other chronic diseases. It's really a suite of services that's much needed in the community, and COVID really unroofed laid raw really the need for this across the country, but certainly in the areas that Lifelong serves.
Yeah, well, and thank you for sharing that. And I really like the emphasis on the community support and community belonging, because I think, again, we've been very lucky as a community that we have so many people who have just really stepped up and said, I want to help. How do I get involved? How do I do this? But also people who have received services and now say, I want to give back. How do I do this for somebody else? And that's been just so fantastic to see. But I do think that there's a really important part of that community belonging too, in providing support that mitigates some of the barriers around stigma or marginalization, because when we talk about the folks that we're trying to reach and we're trying to serve, a lot of them are not just facing the systemic barriers, but they have additional barriers of being stigmatized, of not having equal access, of having these additional barriers. So I wonder if you could talk a little bit more about some of those barriers that you're seeing either during COVID or just overall in your work.
Well, I think that, I think we have the next graphic really shows some of the current COVID. And if you don't mind, Claire, I'm going to actually put on my epidemiology hat for a little bit and just talk a little bit about where, what I'll kind of, help to frame where we are in the COVID pandemic. And then start to talk about a little bit of what you're talking about why we're seeing such disparate rates of infection and others, in certain communities, and how can we, Lifelong, the health industries, many of those on this call in different industries, like how can we help to address some of these challenges? And I'll step back, back, a little over a year ago now was when, the first cases were reported. It probably happened at the end of 2019, starting in the Wuhan province in China. And then, as we all know, spread worldwide. I only want to put that in context in that even if we look at the, the rates. So if you go to, the famous Johns Hopkins website and you look, you see the US has so many cases. Well, I'll only point out that Nigeria, a country that's the 7th most populous country in the world, has very, very few reported cases, because the way we report these cases is a positive test. And many countries don't have the resources to roll out mass testing like Europe, Japan, several countries have rolled out. And so even as we look at, sort of the worldwide distribution, many countries don't even know the extent of the epidemic within their countries. And so there's a worldwide disparity, even for just getting the diagnosis of the disease and seeing how widely spread it is in their communities. So now let's take it back to the United States, and the Puget Sound region actually not only had the first diagnosed case here in the United States up in Everett, but also had one of our first populations, the nursing home populations, that also were disproportionately hit because they were congregate facilities where a lot of people lived closely together, and an age group that is also at higher risk for the disease. So that was here in the Puget Sound region. So unfortunately, we had early recognition that this was going to be a pretty significant epidemic here in the United States, and yet almost immediately we started seeing the numbers that we're seeing on this slide, which are very disproportionate hospitalization rates for COVID. And again, you just look at the numbers and they are striking. Right, 5.3 times of Indigenous Americans that are admitted to the hospital, 4.7 times the rate of Black citizens here in the United States compared with white citizens, and then 4.6 times for Latinx communities. And these health disparities come from so many different sources, and it's certainly I think we're still learning about them, but sometimes it's the type of industries, the food service industries, for example, and processing plants and other agriculture were very highly affected. Incarcerated people who were incarcerated had very, very high rates early on. And those that were living in certain types of shelters or certain types of congregate facilities were also affected, which are part of the explanation, but really a larger part is that there are large health inequities. We saw huge differences in South King County versus Central King County, and you can almost map it out not just by sort of racial and ethnic groups, but also by income levels. And you could see that as you move further south in King County, where the income levels were down, the rates were way, way higher. In fact, currently we're currently seeing a spike in cases where we're probably, and again, I'll say this only because the director of the CDC said it this morning, but we're very likely seeing the beginning of a fourth peak now because of these variant strains that are out there. And they continue to disproportionately affect certain members of our community. And that's when we talk about health equity, and the vaccines are no different. I'll only point out that when you look at the hospitalization rates, that's one lens to look at it. I recently looked at a graphic that looked at every one of the 50 states, what the populations of certain ethnic or racial and ethnic groups are. And in all 50 states, every single one of our states, the proportion of BIPOC communities of getting vaccines were less than that of represented by the census. Every single one of the 50 states. And that especially for Black individuals, that's just shows the level of systemic health disparities there are, and that's where I feel like the mission and vision of Lifelong really helping to address these issues by delivering these services, getting people on their feet, helping them with some of the stigmatization that happens with these, forged from the birth of Lifelong through the prior pandemic, the AIDS pandemic, and really being applied now in that flexible way that Claire said, is really kind of, one of the, I think, really bright spots, if there are any, in the opportunities that we have to help address these really significant underlying issues.
Well, thank you. I'm glad you pointed that out. And I just feel so strongly that there is this kind of opportunity now where we do have a larger light on some of these systemic issues and the chance to change things with a little bit more will and recognition that these are long-standing issues, and that if we don't address the underlying causes, that we're going to be back here again and again and again as new challenges come up. And so we really do have to get to some of these root causes. We have to be able to look at what's beneath these disparities that we're seeing. And I know you have a slide here, so do you want to talk a little bit more about what some of those root causes are, or what you've seen?
Yeah, no, I think that as we look across, and I'll sort of maybe take each one, and I think we have a little bit of time. Let me take each one and sort of comment on what we're experiencing and what, both healthcare systems as well as, organizations like Lifelong are seeing. The mistrust comes from years and years of underinvestment in certain communities, be them, again, income related or others. We live in a world where insurance is primarily driven, at least sort of the commercial insurance, by employment, right? So if you're not employed, or if you're actually self-employed, insurance is very expensive. Healthcare is very expensive because we tend to focus a lot on sick care. And there's a lot of mistrust in communities. In South King County, for example, many of the communities, the BIPOC communities, actually, explicitly state that it's unclear whether organizations that even, I think, well-intentioned, who come out, but I think many of the communities legitimately ask, well, where were you? We needed you also, for a lot of other chronic health conditions for years and years, and now you're coming to do some testing and other things. And really, my organization is really trying to have a longer view of how we help to address community partnerships, right? And how we help communities where they want to be met, and how they want to have these conversations. No community wants people to come on in and say, hey, if you only stop smoking and help address violence and drug use, well, that's not their fault. The systemic causes of poverty and homelessness and other things that potentially drive some of the challenges in regards to food access and other things, are very large social economic issues. Health literacy is also something that we talk about, but I feel like sometimes health literacy is, again, getting to that, how do communities want to interface with health and wellness organizations like Lifelong, like MultiCare, like some of the other healthcare organizations. And we're only really learning about that by reaching out to the communities and helping to interface. The chronic stress and those things, I think I already mentioned. Crowded living conditions have always affected this, where it started in the nursing facilities, but also homeless shelters, prisons, which disproportionately affect certain racial and ethnic groups. Poverty, I've already talked about a lot, and is a key driver in some of the health inequities. And I'll say racial and social discrimination, right? When we look at the vast difference in the different racial and ethnic groups and how they're affected, but also just the stigmatization, right? We're talking about even something like the Asian hate, right? Which is something that's derived from how we talk about diseases, right? At least partially. And there's stigma in so many different directions. Of course, the access to resources we've talked about as to how Lifelong really helps with that. And then I would just say that discriminatory policies, some of the vaccination rates aren't something new in regards to racial and ethnic differential in getting flu shots or getting other healthcare intervention, health and wellness interventions, be it colonoscopies or other kind of key things. And I think that some of these are based on payment policies. Some of these are that there are health and other deserts. Like I said, South King County, the access to healthcare is few and far between. Whereas when you start to get closer towards downtown Seattle, you almost you just can't walk a block or two without having access to some type of healthcare, but usually those requiring some type of private insurance or self-pay. So, I think that the inequities are driven by a lot of these social determinants. And only by addressing these social determinants, like Lifelong's mission really lines us up to, will we start to get ahead of this. And this won't be the last pandemic that we deal with here in the United States. This shows us where the opportunities are. And I think it also helps to focus us. And this is Lifelong and other partner organizations in the community that have really banded together, like Claire mentioned, to do this together, along with governmental advocacy and a lot of other things that I think we can do as a community to help those communities that are disproportionately affected.
Well, thank you. I think it helps to have this so clearly mapped out with the different causes. It is a little overwhelming to see all these different root causes coming together. But like you said, I think the secret is really community partnership and working with the community to try to solve these issues and understand what the causes are, and then how do we propose new solutions. And so I'll just say one of the follow-ups that we hope to do from this Food for Thought is to talk a little bit more about some of those partnerships we're building now and have been building over the years to try to address some of these areas. So I'm really excited about the direction we're going with this, and I think there's a lot of great opportunity for us to work with organizations that have been in the community for a long time and leverage the strengths of each of our organizations to try to tackle some of these bigger and bigger issues. Great. Well, I know that we wanted to save a little bit of time for questions. Allie, would this be a good time for us to take a question from the chat?
Yeah, absolutely. So just a reminder to everyone that's in attendance today, if you have a question, feel free to use that chat feature and send your questions our way. If you're having trouble with that, you can also raise your hand and we can call on you if that works easier. Our first question that we're going to get into comes from one of our audience members. Let me get to it here. So they say, I know a lot about the food that Lifelong provides, but you had mentioned housing and other services. Can you talk a little bit more about what those are?
Absolutely. Thank you so much for asking. That's a great question. We really do try to have that holistic model. So we have a few different areas where we provide support. Obviously, you said you're familiar with our food nutrition program. That's the Chicken Soup Brigade. So that we deliver medically tailored meals to people to make sure that they're getting food and nutrition that meets their medical needs. We also have our aging and disability services. So those are oriented around ensuring that people can have the care and support they need to remain in their homes. So they don't have to be institutionalized or go into a nursing home facility, that they can stay in their home but get the care that they need. So that's a really exciting and wonderful program. We have our care and prevention area where we're providing medical case management and then sexual health and prevention testing and education, so we can ensure that people understand how to stay healthy and that they have access to the support and the resources that they need. And then we have our access to care program, and so that's really focused on providing insurance support and help to get insurance and to have those payments covered. We have a dental program that connects people with dental care providers so that we can make sure that their dental health needs are met. I know many of you know with HIV, there can be dental problems that can cause a myriad of downstream effects. And so making sure that people have access to good dental care is very important and maintains good health overall. And then we have an eligibility program that helps us understand when people come to Lifelong, what are all the universe of services and programs that they're eligible and available to have, so that we can make sure that we get people matched with the right services for their needs. And then finally, we have our housing program. And so within our housing program, we've got housing related to our HIV clients, and then we also have housing related to our tiny house villages. So for our HIV clients, we're looking at housing for people who are unstably housed, getting them into transitional housing or to long-term housing. How do we provide that support and those wraparound services to not only get into housing, but to allow them to stay in housing? And maybe we can provide some employment services to help them find work so that they can pay their rent. How do we get them through kind of the rough patches with rent assistance and support in talking with their landlord? Oftentimes people will come to us and they'll have, they may have had trouble in the past, and so that can follow people for a long time. So how can we be their advocate to help, smooth the road for them to get into housing, ensure that people feel comfortable and able to get them into that housing so that they have that support. And then with tiny house villages, I don't know if many are familiar with that model, but that is housing that is collective, where people have their own little houses all together in a neighborhood, and then our folks can provide case management where they're getting them into transitional housing and long-term housing from there, but also mental health and substance use support, so that folks that are coming into the tiny house villages, often they're coming in having not had housing in the past or having long histories of not being housed. And so there's a lot of kind of wraparound support and services that they need to make that transition successfully. So how do we make sure that we can have them stabilize, get them the support they need, and then get them into longer term housing? So I think it's, like we talked about before, all of these services are connected, and people's needs change from time to time, and different people have different needs. So we really try to look at the totality of the person and what they need in the circumstances, and then provide the wealth of services to them. And then where we can't provide services, obviously we're looking to our community partners and trying to make sure that we're connecting them to resources out in the community as well.
Yeah, and I'll only add that, as a community referrer to Lifelong, I did not appreciate fully all of the resources that Lifelong gave to my patients. Sometimes they probably just did it as a wraparound, because a lot of the referrals I did were for case management, which then, addressed some of these other social determinants. But as I joined the board, I realized that Lifelong, and I think this still is, unfortunately, one of the better kept secrets in the Puget Sound region. It's just that Lifelong really does offer these incredible wraparound services to patients and communities. And the flexibility has really been not only forged by where it was founded in the HIV/AIDS crisis, but also that Lifelong has evolved along as the HIV disease and treatments have evolved over time. And that's where Lifelong, I think, continues to really look at that whole person care and really broaden this suite of resources that really help, especially those that have other health needs and chronic disease needs and social determinant needs. And again, I see some of the comments, but really kind of getting the word out, and then helping people be aware of all the different opportunities that Lifelong has, that we can contribute with other partners, and then the volunteers are a fantastic resource. My family and I have volunteered multiple times in the Chicken Soup Brigade, and I'll just say that my kids, who were teenagers, they just love it. They just even though they cry when they cut pounds and pounds of onions, they at the end of the day, they're always like, when can we go back, Dad? And I can't wait for sort of COVID to sort of allow us to get back into the kitchen again as a family.
Well, thank you.
That's a great transition into this next question we have. Maybe we can start with Mike, just as a provider in the community. Kind of, are there ways that you see community members really able to kind of help with these disparities, or what would you say to someone that is looking to get involved? And then we can switch to Claire, which I'm sure she has some thoughts on it too.
Yeah, I think that there's so, I guess, boy, that could be another whole session in and of itself, because I think that, part of it is doing what we're doing today, which is having conversations about the topics of these social determinants and all of those different aspects that affect people's health, right? Like I grew up in healthcare, right? That 20% of a patient's health, that when they get really sick, we're there for them. I mean, we contribute as a valuable, I feel, community resource, but we're also constrained in many ways by the payment models of healthcare in the United States. And I think having conversations about all of these aspects of social determinants, about how racism affects disparities in health. I see a comment about that in there. Having those conversations, and then Lifelong provides a platform that we can turn some of those ideas into where are those communities that have the most need, and that flexibility and multi-services part of Lifelong allows the community to then contribute in ways that you feel, people go in with the food delivery side of things, or into the different aspects of the housing, and we can contribute in different ways, especially through different partnerships for some of the housing work, for some of the senior work. And there's a lot of overlapping places where not only we look for community partnerships. For example, my healthcare system and Lifelong are in conversations on how we can start to look at food, and when we see patients in the hospital that get discharged, for example, by having a very poor diet and having congestive heart failure and other recurrent reasons that bring them to the emergency room, how could we better partner with the medically tailored meals of Lifelong to create a smooth handoff, so that we can work together to help address food inequities? And that's just one way. And I would bet that most people in the community who are, let's say, working in different industries can see similar overlaps where, maybe their industry can cross over and partner together. We've had Microsoft and some of the tech companies really do a lot of, that volunteerism and other partnerships with Lifelong. So I think there's kind of cool ways, and one is escalating the conversation. The other ones are really then with that escalated conversation, looking at where we can do the most good. And as a board member in Lifelong, like, that's what I see Lifelong wanting to do. And with Claire's leadership and the leadership teams that are there, it's about sensing the community. And that's where I think it starts with. Claire?
Yeah, well, thank you. I couldn't agree more. I think that was beautifully put. And I just keep thinking back. I'm really excited because earlier this year, we went through a process to define our new values for Lifelong. And so we, brought the team together and had this great process across the organization to say, what really are our values, and how do they inform how we work? And one of those values was that we adapt and grow based on community need. And I think that's something that, obviously you've heard that the organization has done since the very beginning, but it feels very true to who we are, but also to who we need to be able to serve this community. And so I'm really excited that people are asking how to get involved. I think there's a myriad of different ways that people can get involved. It is a little bit different now during COVID because our volunteer shifts are, somewhat more prescribed because we have had to scale things back to keep everybody safe. And so right now, most of the opportunities are within Chicken Soup Brigade, but we've had opportunities in the kitchen, in delivery, in the warehouse. I think we've done things where people could write notes of support, where people could do grocery bags at home. So we're trying to find different ways that people can continue to be engaged, because again, we've just seen this outpouring of support and people saying, I want to help. How do we get involved? And so I think, like Mike said, that partnership and that looking at, okay, we know what these issues are. How do we get together creatively and try to solve for this? What can we do together? That we've had a lot of those really exciting conversations. And I just think there's so much energy right now around getting together and trying to fix some of these things that have been longstanding problems. So that's really exciting to see.
It just made me reminded me, Claire, as you're talking about that. My daughter also volunteers at the thrift store, which we have. We have a thrift store, and they just opened back up for the volunteers to be able to come back in. But one thing my daughter really commented on is that even the thrift store, getting affordable, clothing for people who really, I think, can benefit from that. There's certainly a whole variety of folks who shop there, but it's that concept around food and clothing and shelter and social services that really is just makes Lifelong a really standout organization, in my opinion. Even in a city known for, or a region known for, having really powerful philanthropic organizations like the Gates Foundation and others. But I would put Lifelong right up there with the Gates, minus a few $1 billion.
That's why you're on our board, right? Thank you.
Thank you both. Mike, I know you mentioned a little bit earlier, you mentioned food equity, and I don't know that we've really dove into that too much today, but I wondered if maybe you could just kind of speak to that a little bit, and then maybe punch it over to Claire on maybe what we might be looking at in dealing with that as the new normal has kind of settled in, and kind of what we're doing at Lifelong and planning in the near future.
So, food. So one of the key demographic items, if you look at all communities, you'll notice that the poorer the community is, the less access to fresh foods like grocery stores and other stores that provide healthy food, and much more in regards to what we would consider junk food, or high fat, high salt food that's affordable, right? I mean, that's one of the fantastic things, is that it's affordable, but it's not necessarily healthy, and especially for communities that disproportionately suffer from chronic diseases like diabetes, high blood pressure, heart disease. And even things like, certain types of cancer, rheumatologic diseases, and others. A healthy diet is really the key. And that's why we sometimes refer to parts of, and I'll just, again, the parts that I know really well, South King County, but many other places are what, historically has been referred to as food deserts, because there's not that access to affordable, fresh foods. And one of the really cool parts of addressing that part of health inequity, right? If you have to drive, 30 minutes and an hour away with traffic to go and get to a place that has affordable fresh food, that just increases the barrier. And then of course, if you have transportation challenges and other things, that makes it near impossible if you have to take the bus or other things, and especially when we're locked down. So Lifelong really has helped to address this through the Chicken Soup Brigade. And remember where this was forged. This was forged due to the cachexia. I mean, people were wasting away from AIDS. And what Lifelong did was a ground up organization, the Chicken Soup Brigade, to raise money and help to bring food to these stigmatized individuals, where many other organizations stayed away. I don't know if folks remember back then, but many dental practices stopped seeing patients who, met the some of the demographics or some of the biases against folks. And the Chicken Soup Brigade went there. And right now, Lifelong is doing that same thing, bringing medically tailored meals that are healthy to communities that are in these food deserts, and really allows people to live their fullest lives. Because otherwise, we see this all the time in the healthcare organizations, that, they're eating high salt diets, and that's really bad for their heart disease, and they'll end up in the emergency room or in the hospital. And we're helping them stay at home, do the things that they enjoy doing, spending time with their families, or even being able to get back to work and do other things to kind of to contribute to their health and wellness. Claire, I know you have a lot of thoughts around the food aspect of what Lifelong brings to the community.
Yeah, thank you for that. One of the areas I think we're really excited about is our culturally relevant grocery bags, because we do believe strongly that food is medicine. And like you said, in these areas where there are food deserts, or where there isn't that availability of food, one of the other things we're finding is that when people do have access to food, if it's food that's not familiar, or you're not used to cooking it, or it doesn't feel like home, doesn't feel comfortable, then it doesn't have that same impact and the same ability to have to change people's health outcomes. And so one of the things that we've been expanding and really growing over the last year is our culturally relevant grocery bags. And so we're able to deliver those to people from the Latinx and East African and Asian Pacific Islander populations. We give them about a week's worth of groceries, and those are both nutritious and familiar and support their health. And then we're working on some future options as well as we go forward, as we understand better what the needs are in the community. So right now, out of the 900 grocery bags we deliver each week, about 20% of those are culturally relevant. So that's exciting to see that continuing to grow. And in total, I think last year we served more than 336,000 medically tailored meals and groceries. So this program has just really expanded, and we do see such a need there. And I guess I will just circle back to another community that I think we've really seen a great need around is the aging and disability services. You know, again, through COVID, you've had people that are, you know, facing barriers already with mobility and access, and now with COVID have been homebound and have, you know, lost some of their support systems and access to some of the resources that they had previously. And so with our services, we've seen that their health outcomes are better. You know, it costs less money. It's people are happier when they're able to stay in their home and be with their families. So it just makes for, I think, better outcomes for everyone involved. So one of the things that we've been very active in at the national level is creating these medically tailored meals that are offered as kind of a prescription, like you talked about, from doctors that could support people's health. So that I think that's one of the things that we're really excited about in this next year, is moving some of that national work along so that across the country, people could see that this actually is something that contributes significantly to good health outcomes, and then is supported as such from the government and from those support services. So that's kind of an exciting area for the future for us.
Yeah, one of the stories that always brings a smile to my face when I first joined the board, they told us that one of the grocery store donations, you know, there was a lot of excess kale, but a lot of the communities that we serve, kale hasn't been necessarily part of that. So pre-COVID, they did some cooking classes and stuff so that people can get used to kale, you know, because we were getting a lot of kale and didn't want to waste it. But, you know, trying to meet a community where they are, but also, you know, showing the community, hey, you know, kale could be pretty cool, and it's a healthy green. So that's always a story that brought a little smile to my face. I was like, what is this kale stuff, you know? And
right.
I sort of said the same thing to my wife when she started cooking it. So.
Right. I needed a little education in that area too. But then when you learn the good recipes, it opens up new possibilities, right?
No, we love kale now. So
yeah, that's great. That's great.
We've had some great discussion in the chat. I just wanted to call out both Beth, who has been a longtime volunteer, recent donor. So thank you so much for your support, Beth. And then who's the other one here? Therese has also been a volunteer and has just celebrated her 1-year anniversary. It's allowed me a social outlet that wasn't really possible anywhere else. This program has been fabulous. So we really appreciate that. And then Mike, there's a question for you. Do you know what the scene is behind you?
Oh yeah, no, this was from my last vacation prior to COVID. So it was the summer of 2019, and we rented an RV and went up and down Banff and Jasper up in Canada. And this is Moraine Lake, which I think is the prettiest lake I've ever seen. And this is actually like a picture for us. I think my daughters are somewhere behind me on there, but it's a really, really pretty lake and up in the Canadian Rockies.
Wonderful. Well, we'll give folks just another couple minutes. I think we've got time for maybe one more question if you want to pop it in the chat. Any other things that you wanted to touch on, Claire or Mike, that we may not have gotten to yet?
You know, I'll maybe just throw in one thing that, you know, for all of those, and I know it looks like some people had to drop off, but, you know, we would love feedback on, you know, how we can make these type of sessions. You know, we were really excited to do this today because, you know, interacting with the community, having these conversations about sometimes challenging topics is hard in the era. We would love to do this in person too, once we can. But give us feedback, give us some great other topics that we could bring to forums like this, and other topics you'd like to hear about, talk about, and engage about. Because you know, as a board member, I think that we're really, really interested in how we can better understand the community and have the community better understand lifelongs and all the different opportunities and options that it gives. Claire?
Oh, yeah, no, thank you so much. I think that's an excellent point. And yeah, we would love to hear more from all of you. I think for us, we would love to spend some time just learning from you what you would like to hear more about, what partnerships could we highlight, maybe if there are services that we offer that you're not as familiar with, if we could dig into those. I think like everything that we've talked about today, the organization really is community led. So as much as you can lead us and help us understand what your needs are, then I think we can have some really good discussions going forward.
Wonderful. Well, I just put a link in the chat that takes you to a quick survey that you can, anyone here in attendance, fill that out. Let us know what topics you're interested in exploring for our next roundtable series. Or if you have any other comments, feel free to include those in there as well. I think we are about up to a close, so I'll hand it back off to Claire for some closing remarks.
All right. Well, I just want to thank you all so much for joining us for this great discussion. Thank you, Mike. It is always wonderful to have you with us. Really wonderful to talk with everybody today. Please do stay in touch. If you could fill out the survey, give us ideas about what you'd like to hear in the future. Follow us on social media or consider subscribing to our monthly newsletter. We are going to be offering some more stories of impact and sharing some of the outcomes of our work. So would love to have you engaged with that. And then, of course, we talked about some of the volunteer opportunities and just think it's a great way to get involved and to connect more deeply with the mission. So we'll be sending out a recording of this presentation in the coming days. But if you have questions that you weren't able to ask today or you think of down the road, please don't hesitate to reach out to us. You can reach us at lifelong.org and our contact page, and we'll get back to you as soon as we can. And please do be sure to mark your calendars for our very next roundtable, which will be on Tuesday, April 27th at 6 p.m. So do keep an eye out for your invitation, which will be in your inbox soon. So again, thank you all so much for joining us. Great to talk to everybody tonight. Hope you have a wonderful evening. Thank you.
Thank you, Claire. Thank you, Mike. And thank you, everyone, for joining us today.